Hello everyone, welcome to NAC OSCE preparation course. My name is Dr. Chinyere Obasi, Starmed Medical Education. Our topic today is on hoarseness. Disclaimer: the content of this video is for educational purposes only and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. By definition, hoarseness is the change in quality of the voice, ranging from voice harshness to voice weakness. It reflects abnormalities along the vocal tract, from the oral cavity to the lungs. Hoarseness is a common symptom of laryngeal dysfunction. Let's look at a clinical case. 60 years old Mr. S presented with hoarseness of voice and unintentional weight loss. He has smoked for 20 years with at least one packet of cigarettes a day. What is the differential diagnosis? The answer to this clinical case will be discussed by the end of this presentation. What are the risk factors? Hoarseness is very common. About 1/3 of people will have it at some point in their lives. Anyone at any age can experience hoarseness. This symptom is more common in smokers and those who use their voices professionally, like teachers, singers, sales representatives, and call center operators. What are the red flags? 1. Persistent hoarseness. If hoarseness lasts for more than 10 days, please investigate and refer appropriately. Other red flags include otalgia, dysphagia, stridor, significant smoking history, odynophagia, neck mass, fever with night sweats, and weight loss. How do we diagnose hoarseness? Diagnosis is based on history and examination. If we find a mass, we can biopsy the mass, send for CT scan, or order for MRI. What are the differential diagnoses of hoarseness? There are a lot of differential diagnoses of hoarseness, but we're going to look at least 10 of it. Number 1 is infectious or inflammatory. Examples include laryngitis, pharyngitis, tonsillitis. Number 2 is neurological. Example is vocal cord paralysis due to laryngeal nerve injury. Number 3 is gastroesophageal reflux disease. If it's been diagnosed, we can use proton pump inhibitor for treatment. Number 4 is vocal cord polyps or nodules. This causes hoarseness by the end of the day. Number 5 is lifestyle, like smoking, chronic alcohol users. Number 6 is iatrogenic injury following thyroid surgery, parathyroid surgery, endoscopy, and or endotracheal tube insertion. Number 6 is benign tumors like papillomas, minor salivary gland tumors, and cysts. Number 7 is endocrine causes like hypothyroidism, virilization. 8 is malignancy. Examples include thyroid malignancy, laryngeal, and esophageal malignancy. Lung malignancy is the most common cause of extralaryngeal vocal cord paralysis. Number 9, psychogenic aphonia, hysteric aphonia, those who choose not to talk due to psychological reasons. How do we treat hoarseness? Treatment depends on the cause. If it's based on a benign causes, we employ vocal hygiene and or speech therapy. Vocal hygiene strategies include smoking and alcohol cessation, reducing intake of caffeinated beverages, adequate hydration, and use of humidifier. Hoarseness caused by voice overuse, we recommend voice rest. Remember to tell the patient to also avoid whispering, which is also as bad as using the voice. For vocal cord efficiency, we need to hydrate the vocal fold by staying hydrated and using humidifier. Those who use their voices professionally, we need to recommend regular speech therapy. If hoarseness is associated with heartburn and chronic throat clearing, we can do a trial of proton pump inhibitors and recommend lifestyle modification like weight loss and regular exercise. If hoarseness is following upper respiratory tract infection, for instance, viral laryngitis, which is more common, it's usually self-limiting. However, we can employ over-the-counter lozenges and recommend vocal hygiene. At any time, if we have hoarseness that is persistent or with any of the red flags, we should examine appropriately and refer to otolaryngologists. In terms of Mr. S, top on our list for the differential of his symptom is lung malignancy. Given that he has smoking for 20 years and also he is losing weight, lung malignancy should be top on our list. Thank you.